Many thanks for staying with us. Let's talk health now. The Nigeria Center for Disease Control says the country is at moderate risk for human metapneumovirus in a public health advisory. The agency said the federal government is closely monitoring the outbreak of the virus and is taking safety measures to strengthen the country's preparedness and response capacity. The NCDC said it conducted a risk assessment of the HMPV in collaboration with the Federal Ministry of Health and partners such as the World Health Organization, the U.S. Centers for Disease Control and Prevention, and the UK Health Security Agency. While there are claims in some quarters that the World Health Organization has declared HMPV a public health emergency of international concern, the agency described it as false and should be disregarded. So to discuss this more, we are joined by Dr. Adefolarin Opawoye. He's an infectious diseases consultant, Lagos University Teaching Hospital and Public Relations Officer, Nigeria Infectious Diseases Society. Thank you so much for joining us on the news, Dr. Opawoye.
Been here.
So do you think that the HMPV is a moderate risk for Nigeria?
Well, the NCDC has declared it a moderate risk, so we're going to follow that. Remember that with public health emergencies, it's best to err on the side of caution. Even if you're going to be said to be overthinking it, it's better that way than to be underprepared. So because remember, this was what happened during COVID, that the world was caught unprepared, and that is definitely influencing the outlook on things now. So yeah, moderate is fair enough. It makes us getting ready without necessarily throwing our toys out of the pram. So that's just the best way to do it. Moderate risk is a fair enough classification.
All right, so what are the primary symptoms of the human metapneumovirus, and how can it be distinguished from other respiratory infections?
Okay, well, so the challenge with it is that it's really difficult for you to separate it from other respiratory viruses like your influenza, respiratory syncytial virus, other causes of cold. So it's just basically like common cold, meaning that people may start with some feeling unwell, which we call malaise. You may have fever, sore throat, some catarrh, some cough, and some body aches. So basically that's it. And, like I said, it's really difficult to distinguish it from other causes of similar illnesses. So it's not like they have really distinguishing features at the level of the clinical features. Now, you'll be able to test it at the lab and be able to distinguish it as a viral cause of an upper respiratory tract infection, viral pneumonia. Was really difficult to look at a patient and say, oh, this is HMPV and not RSV, and it's very, very difficult to do that clinically.
Okay, so then what are the safety measures and protocols you would expect to be put in place at Nigeria's international points of entry, at least to prevent the spread?
Well, so I think there are some things that we need to put in context there. It says that this is a virus that's been circulating for a long time, and hopefully, generally, we have quite a lot of immunity to it. If you look at the news coming out from China, which you really have to be careful how you take it, because China is never fully open. But in so much as what we know is that it's usually ages less than 14 that are really affected, mostly children, because they don't have immunity as strong as adults. So it's not like COVID, which was a new infection that spilled from animals, as at 2019, 2020, that we didn't have immunity stockpiled against it. This one, we are sort of like prepared to counter it in a way. Our bodies should be able to deal with it. So we're not going to start running around now doing a lot of things. Now we can do things out of abundance of caution, which is screening at our points of entry, temperature checks and all that. But remember that diseases don't move in isolation. The fact that we're looking at HMPV, that's the Human Metapneumovirus, doesn't mean that other diseases are on strike. So screening is always good, but at this point, there may not be a need for enhanced screening yet. But situation is being monitored closely from China. WHO is on it, other health agencies are on it. And when we need to escalate, then we're going to escalate as needed.
All right, so are there any vaccines or maybe any antiviral treatments available for this virus? And probably if there are research works being done to actually address the spread in the near future?
Yeah, well, I mean, there's always research going on in all of these things, and the challenge is that prior to now, it's not really been a cause of concern. I mean, this was a virus discovered in 2001. It's not been associated with a lot of mortality, so there's not really been a lot of focus on it. You know, maybe now there's going to be a lot more funding and research focus on it, but so far we don't have any vaccines. There are no guaranteed treatments. Treatment is basically supportive, meaning that there are no direct antiviral agents that can work against it. But if you treat the symptoms, you treat the cough, you treat the catarrh, you treat the body aches and all that, most patients will get better, you know. So, but there's no direct treatment for it, and there's no direct vaccine for it as at this time.
All right, Dr. Opawoye, before I let you go, we heard stories around the COVID-19 pandemic as at that time being a hoax, so to speak. Are we so sure that this HMPV virus is actually a real?
Well, I mean, they said COVID would be a hoax. It turned out not to be one. We know this is real. We know there are outbreaks. What we're saying is that there has to be a measured response to it. Like I said, it's about 5 years ago now that we first got exposed to COVID. And let me say there's still a lot of post-traumatic stress disorder from that. There's a lot of PTSD from the experience of the COVID. So you can bet on people overreacting now. Now we have an overabundance of social media compared to 2020. A lot of people are taking all of advice on social media channels. And that's why I'm happy that media like you, they are doing responsible interviews to let people know that at this time, there is no cause for alarm. People have asked me, can they send their children to school? Should they shut down? Should they go into lockdown? Should they pack their bags and go to Antarctica? No. This is a virus that we know. This is a virus that our immunity has a response for it. There is no cause for alarm as at this time.
All right, thank you so much, Dr. Adefolarin, for sharing your thoughts with us.
Thank you.